Welcome to Landmark Trials in Gastric Cancer Surgery. Today we'll review the MATTERHORN trial, one of the most important studies in resectable gastric and gastroesophageal junction cancer. For years, perioperative FLOT has been the standard treatment. However, despite optimal chemotherapy and surgery, recurrence rates remain high. MATTERHORN investigated whether adding the PD-L1 inhibitor durvalumab could improve outcomes. This was an international Phase 3 randomized double-blind trial that enrolled 948 patients with resectable gastric or gastroesophageal junction adenocarcinoma. Patients received either perioperative FLOT plus durvalumab or perioperative FLOT plus placebo, followed by durvalumab or placebo monotherapy for up to 1 year. The primary endpoint was event-free survival. The results were impressive. 2-year event-free survival improved from 58.5% with FLOT alone to 67.4% with durvalumab plus FLOT. This represented a 29% reduction in the risk of recurrence, progression, or death, with a hazard ratio of 0.71. Pathologic complete response also increased substantially, from 7.2% to 19.2%. Importantly, adding durvalumab did not increase major grade 3 or 4 adverse events, did not delay surgery, and did not meaningfully delay postoperative treatment. Clinical benefit was observed regardless of PD-L1 expression. Overall survival showed a favorable trend. However, the data remain immature. My take is that MATTERHORN represents a major advance in perioperative therapy for resectable gastric cancer. The improvement in event-free survival, together with a higher pathologic complete response rate and no apparent compromise in surgical delivery, makes this one of the most practice-changing gastric cancer trials in recent years. Overall survival data are still evolving, but this study is likely to influence future treatment guidelines. Based on the MATTERHORN trial, this regimen should be considered for all fit patients with resectable gastric and gastroesophageal junction adenocarcinoma. PD-L1 CPS would not influence my decision to offer perioperative durvalumab. The biggest unanswered question is whether the improvement in event-free survival will translate into an overall survival benefit. If longer follow-up confirms an overall survival benefit, I believe this regimen will become the new perioperative standard of care. If you enjoy concise reviews of landmark gastric cancer trials and robotic gastrectomy, subscribe for future videos.